Hey, welcome to The Explainer. Today, we're going to dive into what is, no joke, one of the most incredible success stories in modern medicine. The story of how we figured out how to stop HIV from passing from a mother to her child.
All right, let's kick things off with a number. Just one number that tells a huge story. 25%. Not that long ago, if a mother was HIV positive, that was the chance, a 1 in 4 chance that her baby would be born with the virus. Just let that sink in for a second.
And now, look at this. Today, that risk is less than 1%. I mean, that's not just an improvement, that's a revolution. It's an absolutely stunning drop, and it's all thanks to an amazing system of care that we're about to break down.
So, the big question is, how on earth did we go from that terrifying 25% all the way down to basically zero? Well, to really get why this is such a huge win, you've got to understand what the problem was in the first place.
Okay, so researchers figured out that the big danger zone was during labor and delivery itself. You know, it's an intense process, and that's when the baby was most likely to be exposed to the virus from the mother's blood and other fluids. That was the weak point, the moment that medicine absolutely had to solve.
Right, so how did they do it? The answer wasn't some single miracle cure. Nope, it was a really smart, proactive strategy that kicks in right from the beginning of a pregnancy. It's all about two things. First, you find the virus, and then you get it under control.
And it all begins with just knowing. Step 1 is universal HIV testing for every single pregnant person as early as you possibly can. Now, if there are some ongoing risk factors, they'll do another test later on in the 3rd trimester. And get this, if someone shows up at the hospital to give birth and nobody knows their status, they do a rapid test right then and there. The whole idea is to build a safety net so tight that nobody slips through the cracks.
So, okay, once HIV is diagnosed, this really clear, super effective game plan just snaps into place. It's simple. 1, you test. 2, you immediately start a powerful cocktail of medications called antiretroviral therapy, or ART. And 3, you watch it like a hawk with monthly check-ins to see exactly how well those drugs are doing their job.
Okay, now this is where things get really fascinating. All of that testing, all of that monitoring, it all boils down to one single super important number. And this one number pretty much dictates the entire game plan for making sure the delivery is safe. And that number is what we call the viral load. It's actually a pretty simple concept. It's just a measure of how much of the HIV virus is floating around in the blood. The whole goal of that ART treatment during pregnancy is to hammer that number down, to get it as low as humanly possible. Ideally, so low that machines can't even detect it. And here it is. This is the magic number, 1,000. 1,000 copies per milliliter of blood. Years of research basically drew a line in the sand right here. Whether the mother's viral load is above or below this number when it's time to deliver, well, that changes everything. So what this does is it creates 2 totally different paths forward. It's super clear. If that viral load is at or below 1,000, the risk is so incredibly low that a vaginal delivery is perfectly safe. But if the viral load is higher than that, the whole plan shifts. We're talking the scheduled C-section at 38 weeks, plus some IV medication to basically create a bypass around that high-risk moment of labor.
But wait, it's not over yet. The protection doesn't stop the second the baby is born. There's one final, absolutely critical layer of defense that gets put in place right away to make sure that baby stays healthy.
Every single baby born to a mother with HIV gets a dose of preventative medicine. And the timing here is everything. They want to get that medication started within just 6 hours of birth. It's a race against the clock.
And just like the delivery plan was tailored to the viral load, the baby's medication is too. It makes perfect sense, right? If the mom's viral load was super low and under control, the baby just gets a simple 1-drug regimen for a couple of weeks. But if the mom's viral load was high, or if we just don't know, then the baby gets a more powerful 3-drug therapy just to be extra safe.
Okay. So, with all this incredible protection in place, there's a really big, natural question that comes up for every new parent. What about feeding? This is a really important point. Even when a mother's viral load is undetectable in her blood, tiny amounts of the virus can still be present in breast milk. And because of that small but real risk, the current guideline in the United States is to avoid breastfeeding and use formula instead. It's all about getting that risk as close to zero as possible.
All right, so let's just take a step back and look at the whole picture. You've got the universal testing, the powerful therapy, the smart delivery planning, the newborn care. When you put all of these pieces together, what you get is one of the greatest success stories in the history of modern medicine.
I mean, just look at this comparison. It's night and day. We went from a world where there was a 1 in 4 chance of a baby getting HIV from their mom to today where, with the right care, that risk is, well, it's practically gone. It's a complete transformation in a single generation.
And maybe the most important part of this whole story is this. While the science gives us these clear guidelines, they aren't just orders handed down from on high. The entire process is built around conversations, around shared decision-making. In the end, after talking through all the risks and all the benefits, it's the patient's choice that's respected. And that's pretty amazing, right? It's a system that combines cutting-edge science with a deep respect for the person at the center of it all. It really makes you wonder, what else can we achieve when we bring science and empathy together like this?